My interest in medicine was accidental. I went to college to be an engineer, but ended up working in a lab with a physician, and he, after working with him for a year, had told me he had assumed I was going to be a doctor. He said I had such great people skills and said, don't be an engineer, come with me on rounds. And I sort of had an epiphany at that point, looking back on my life and my interests, my love of working with children, and kind of all made sense to be a pediatrician. It's a lot of things. I love that children are so honest and open and open-minded. I love watching children grow up. I love interacting with parents. I feel like a lot of the times I'm a teacher, I'm a coach, I'm a counselor, and so I really enjoyed that rapport and relationship that I have with the parents in addition to with the kids. We see babies from the day they're born all the way up until they graduate high school and go off to college. I have a particular interest in adolescent medicine, and of course a lot of teenage girls come to see me. I've been in practice almost 10 years, so I do have a lot of boys that have grown up with me that are now teenagers that still come to see me too. But you know, I have to say I love the whole range. I mean, I love new parents, brand new babies, fresh start. I love the school age. They're so inquisitive and funny, and they get their sense of humor. And but I do love seeing teenagers. They're a challenge, but they're interesting, and it's very rewarding. So. Just being out in the community. So if I happen to be at the Children's Museum with my kids, seeing my patients, seeing them in their element, or seeing them at my children's events, sporting events, or school productions, and getting to see my patients not in the office, but just them really being them in their element, or see them at Target. And I think one of the best memories I have is of I think a 10 to 12-year-old autistic child who I've known for a long time now, and we were at the grocery store, and I always know, I always wait for a child to recognize me first, but he just came right up to me, "Hi, Dr. Aylesworth," and wanted to have a conversation, and I just, obviously that was just amazing. So. Well, it's nice, as a pediatrician to be in a big, large, multi-specialty practice. There are a lot of specialties that are only available through Duke and UNC. However, there are specialties within Wilmington Health, such as ENT and dermatology. That is nice to have colleagues I can instantly refer to, especially dermatology. There's always such a long waiting list, but not within my group. And being able to see when a patient comes back to me, I already have the records, the office visits, the operative notes from the ENT are readily available, so that's very nice.